So a tooth needs a crown when more than 50% of the tooth is gone, whether it broke off, whether it's because it's mushy because you have a cavity, because at this point we've done so many fillings on a tooth that it's starting to go that way. That's how we determine it. We want to make sure that it's being able to function. So if a tooth is missing a good part of it, and then we just put it up with filling material, it'll break. Filling material is meant to fill in gaps. It's not meant to try to remake a whole tooth. So once the tooth becomes more than 50% filling material or 50% is missing, that's when we're like, ooh, we need it. The other thing is to think about is cracks. Our adult teeth start coming in when we're 6 years old. So if we're 36, 56, those teeth have been in service for quite some time. So of course it's quite natural to start having some cracks appear, some craze lines appear. And when those cracks become very distinct and obvious and thick, that's when I recommend a crown, because you do not want to go through having a broken tooth. So the difference between a veneer and a crown is a veneer is a facade. So it literally just goes on the front part of your tooth. And you can do veneers all the way around to change the way you smile, or just, some of your front teeth. Crowns go all the way around your tooth. It's a 360 change of your tooth. And we use that a lot on back teeth and front teeth with teeth that are missing a lot of structure. And that could be due to falling and breaking some of your teeth. It could be due to decay, cavity, or just the tooth is no longer strong enough. You've had a lot of fillings done on this one tooth and now it's 75% filling material, but you're still, chewing on that steak or chomping on that carrot. We still need that strength, and that's where those zirconia crowns come in. They allow us to keep our natural tooth underneath and still function. It's a 2-visit appointment. We prep the tooth. You leave with a temporary crown, so you're not leaving with a naked tooth. You will always have a tooth there. And then about a few weeks later, we get the final crown back from the lab. We always have a lab fabricate our crowns. They are lab technicians who went through a lot of schooling to make sure that the bite, the shape, the color is what we want, and the strength as well. And every crown is individually made because everyone's bite and their teeth shape are individually made. And crowns can last, I've seen patients who've had crowns for 30-something years. But once again, it depends on how well you take care of things. Make sure you're brushing and flossing, make sure that it was sealed well. It was, have you had orthodontics? Have your teeth shifted? Has it chipped? Some of our crowns, they used to be made of just porcelain and metal, so the porcelain tends to chip off. There's many different things that will change the longevity of a crown that unfortunately we don't always have control over, but the patient may have some control over.